So welcome to the second part of the Foundation Stage 1 Diploma video. I am only splitting this video into two, like I said, for memory space. So I'm just going to continue on. Where we are right now is I've just shown you the workplace-based assessment timeline. I've told you that the consultation skills, pharmacokinetics learning sets and MCQs are their own type of thing. So now I'm going to talk to you about the 9 main types of workplace-based assessments that you need to know about. So the first kind of task is called an FPF, and this is a Foundation Pharmacy framework. And when you go onto it, it's kind of self-explanatory really. There's 4 types of clusters and you're supposed to show that you're progressing in each type of cluster. So for example, there's patient and pharmaceutical care, there's professional practice, personal practice, and management and organization. And so with these, what you do is before your meeting with your tutor, basically fill out where you think that you're, achieving things. For example, patient consent, you should be consistently achieving that because you should be asking them whenever you can access their SCR or information or whatever. Getting relevant information from the patient. That for me was like usually or consistently. So what you need to show is that you're moving across from rarely to consistently. So as long as you're showing that, then your tutor should be fine. The second type of workplace-based assessment is the extended interventions. So these took up a bulk of my time doing the diploma. So this is when you fill out patient details, reason for admission, what the intervention is, what intervention you've actually made, the bloods, what you could have done better. These are kind of like your patient case studies. So as much as I didn't actually enjoy doing them, I would say in hindsight, I did learn a lot from doing them. So it wasn't enjoyable and it's a lot of like writing, but once that was done, I was like, oh, actually, I'd learned a lot. So I sent these to my tutor who then annotated comments and wrote and sent them back to me and was like, I don't understand what you mean here. What about this? You could have done this. And so I learned a lot about what I could have done as well. No one really talks about the level of detail required for the extended interventions, so it's kind of up to you. So I had some really bad ones at the start, which were when I was on my maternity rotation, and then the interventions I was purely making was like VTE for women of certain weight. So that was one. And another one that I had was a patient on the respiratory ward who got COVID pneumonitis, who was prescribed levofloxacin but had a G6PD deficiency, and levofloxacin is contraindicated in those with G6PD deficiencies. And so that's the kind of range that I went from in my extended interventions. Basically, with these, just keep churning through them because you need to do 10 in 18 months. So keep getting through them as much as you can. The third type of assessment was a consistent intervention log. So these are the interventions that you can't do much with. So like, for example, I don't know, if the patient was supposed to be on Senna and then you talked to the doctor and then it got prescribed. Like that wouldn't be an extended intervention, but it's still a small intervention that you made on the ward. And so keep a record of these. I never really remembered to do that. So then when it got to my meetings, I'd be like, oh yeah, my like mini intervention log, yeah, I forgot about that, but that was not good. Like my tutor wanted me to write down every single little intervention that I'm making on the wards so that, we can show that we're still making consistent progress. And even with these mini interventions, I definitely made better interventions at the end of my FS1 than at the start. Okay, the fourth assessment is a MINI-CEX. So this is just a simple ward-based assessment, and you can do this quite quickly because like a tick box. The difference between this and a case-based discussion I will go into later, but with these, whenever a senior visited me on the ward, I would be like, can we do MINI-CEX? And that's when I'd get them done. One tip that I can give you is when the assessors have to give back their feedback to you, it's hard chasing them up because they're also busy and they've got their own stuff to do. So what I would do in the feedback section is that I would actually fill out as much detail as possible. So I would write all about the patient interaction and the patient and all of the details, and anything that they told me verbally was good, anything that the assessor told me was verbally bad. I would basically fill out that whole form for them and then I would send it to them so that they could just add to it rather than start from scratch. Because like I said, they don't have all the time in the world to be sat writing everything about an assessment that they did on you. So make it easier for your assessors, make it easier for them to send it back to you. The fifth type of assessment is your MRCF, and these are your counselling logs. So you need to have at least 5 of these in the 18 months. So just ask around. So we had a group chat where senior pharmacists would be really busy and they'd say, does anyone need a counselling log for a patient? And we'd just go to that ward and counsel a patient. Again, with these, I know that you're supposed to follow the timeline, but I think I did like 3 in a week or something because at the time there was just a lot of people that needed counselling on that ward. That's when I got the most done. So again, it's up to you, but you've done this plenty of times at university. You know how to counsel people. If you're a pharmacist, you don't know how to counsel someone on their medication. Like that's a problem. And so yeah, it's pretty self-explanatory. Just get it done. So the sixth assessment is a case-based discussion. And at the start I was like, so what's the difference between this, like a MINI-CEX and a case-based discussion? Well, a case-based discussion is a lot more in depth. So a MINI-CEX you can get done on the ward, you can just talk about it with your assessor and probably get it done, whereas a case-based discussion is a lot more in detail. And so what I would try and do is kill two birds with one stone. So whenever I had like a departmental teaching that I needed to do, then that's when I would make use of that. So I would present on a case-based discussion that I've done, so that I wasn't having to do a departmental teaching session and a CBD. Again, this one's quite simple. We've done case-based discussions at university. Also, remember to ask your assessor what kind of format they want it in. So I used to do all of my CBDs on PowerPoint, and there was an ITU pharmacist who was like, oh no, I don't like them on PowerPoints. I'd rather you verbally tell me exactly everything to do with the patient, and I want you to remember it. And so how you present it can also differ depending on the assessor, so make sure that you ask that question. The seventh kind of assessment is a social intervention. So these are like your extended interventions, but they're for social issues, and you need 2 of these. So it's kind of like, how are you socially helping? So mine was on a patient who had chronic inflammatory demyelinating polyneuropathy, and she was really struggling to pop out her medications. And so the carers had requested that we change it into a dosset box. And so that was like a social intervention that I made, where I then chased up the community pharmacist and said, from now on, we're going to do dosset boxes for this patient, etc. Another one was for a patient who needed buprenorphine sublingually in community, and we don't discharge patients on that. So I had to liaise with the community pharmacist, make sure that the scripts are there, make sure that this patient can go and get their buprenorphine tomorrow. And then I also had to call the drug and alcohol services as well to make sure that the prescription was sent to the community pharmacy. So again, this is like a social intervention that you can make, and it can be anything on how you can help that patient get home and how you're coordinating that journey. The 8th kind of assessment is DOPS, and this is kind of a direct observation of practical skills. It literally takes like 5 minutes. So mine was someone watching me dispense a dosset, and another one was someone watching me counsel the patient over the hatch on a weekend. It's just a short observation of a practical skill. And finally, the last assessment is the mini-pat, which is basically an email that you send out to all sorts of professionals that you work with. That can be a nurse, it can be a physio, it can be a doctor, it can be another pharmacist, and they basically give you feedback and tell you whether you've been good to work with and whether they think there's any room for improvement and things that you've done well. Okay, so this is my folder at the ready, and oh god, it's so heavy. So have your dividers. So here I've got my FPFs, then I've got my extended interventions all in one, then I've got MRCFs and CBDs, etc. So make sure that you have dividers for each type of assessment. And then basically what I did was I printed out the paperwork for however many I needed. So I printed out, for example, 2 DOPS and 5 MRCFs. And basically what I would do is I would take a few of those out of the folders and be like, okay, this week I'm going to try and get 1 counselling done, 1 DOPS done, 1 MINI-CEX done, and I would carry it to the ward to remind me to get it done. Because if I did not do that, I would not remember to get it done, and I would not do it. So that is what I would say. Due to COVID, obviously, we had some different requirements. For example, I think with the counselling, the number went down from 5 counsellings to 3, because obviously we couldn't see people face to face as much. So there were some different things that we had to do during COVID, but in general, this video hopefully can clarify what you need to do. So after you've got your whole folder ready and you've done all your RETAs, your FPFs, and your 9 types of workplace-based assessments, then you'll have the Foundation Stage 1 exam, which I'm going to make a separate video about because that's completely separate to this folder. So yeah, I hope that these videos were helpful. In my opinion, it's more important that you get the organization correct and that you know what you need to get done. Getting my head around that took longer than actually doing it. So once I was like, oh, okay, this is how many I need, this is what the 18 months looks like, this is what I need to do, oh, this is what a RETA is, okay, that made sense. But until that point, it was kind of confusing for me. So make sure that you understand what is required of you. Also, my advice is definitely not to stress about it. You've got your pharmacist degree. Like, you are a qualified pharmacist, you're working now, you can't add to your stress mid-pandemic because of a diploma. Like, I know a lot of people stressed about it, but I did my best to get everything done in working hours as much as possible. This is not my life. I can't put my life on hold for this diploma is what I'm trying to say. Just keep it all in balance and you'll be fine. And if you've got any questions about the UCL diploma, I'm happy to answer them. Like I said, I don't know anything about the other diplomas, so do not ask me. And I hope that you have a nice day, and I'll see you in the next video.